चलो देखती हूँ, ट्यूसडे को बन गया प्रोग्राम। हाँ नहीं, मेरे को तो ऐसे दिन अच्छे लगते हैं। मैडम
Sakshi, can we begin?
शायद साक्षी अनम्यूट नहीं है।
Yes, ma'am. We will start.
Yes. Sakshi, go ahead.
Sangeeta ma'am, can we make Guneet Kaur co-host?
Yeah, sure.
Thank you.
Ma'am, may I start?
Yeah, sure. Proceed.
Charanjit, I think you start.
Yes, ma'am. Yes, ma'am. Guneet.
Yes, ma'am. Good afternoon to one and all present here. I am Guneet Kaur, the General Secretary of Sports Department, and we have Sakshi with us, the General Secretary of Sports Department. We all are here to know about the breast cancer awareness. But why is it necessary for us to have awareness about this?
Huh?
Do you know that 1 in every 8 women will be diagnosed with breast cancer at some point in her life? 1 in every 38 women will lose her life to this disease. While the incidence and mortality rate of breast cancer have decreased over the past 2 decades, the number of women is still quite high. Every year in October, we do listen such information about breast cancer. But we all are here to know something different, that how exercising on regular basis can help in its treatment and diagnosis. Exercise is an important part of cancer treatment plan. A growing amount of research shows that regular exercise can greatly improve physical and mental health during every phase of treatment. Even if you are not active before your cancer diagnosis, an exercise program that meets your unique needs can help you to get moving safely and successfully. Now I request Sakshi to take over and tell the audience about the rules and the regulations for the session to the audience.
Sakshi, can you unmute yourself, bache? All right. Guneet, we can move forward. We can skip that part.
Ma'am, start.
Okay, she's here.
Wait. Good afternoon, everyone. This is Sakshi Singh, Joint Secretary of the Sports Department. We request you to keep in mind, please don't interrupt between the workshop. Kindly keep your device on mute throughout the session. Please don't press the screen button. E-certificate will be awarded only to the participant who fill the feedback form. Question and answer round will be conducted at the end of discussion. Please drop your question in the chat box. If you have any queries, please drop in chat box. We will taking at the end of session. Thank you.
Thank you, Sakshi, for helping me out with this. Now, I would like to call Dr. Gursharan Kaur, the Assistant Professor in Department of Physical Education.
Thank you, Guneet, and a very good afternoon to one and all. Without further ado, I would like to welcome all the esteemed faculty, the guests, and the participants joining with us today. First and foremost, I would like to welcome our teacher in charge, Ms. Charanjeet Kaur, Assistant Professor, Department of Physical Education, Mata Sundari College. I welcome you, ma'am.
Thank you.
Moving forward, I would like to welcome Dr. Lokesh Kumar Gupta, Director, IQAC, who is the collaborator for our program along with us. I welcome you, sir. Moving forward, I would like to welcome our sports board members, Dr. Kiranjeet Sethi, Dr. Sharda Garg, Dr. Pooja Vadhavan. Ma'am, I welcome you all. Thank you for joining with us today. Furthermore, the program cannot be taken forward without introducing you all to the leader who always inspires us with her hard work, enthusiasm, dedication, and vision to conceive innovative ideas and organize such programs. Ma'am, with heartfelt gratitude, I welcome you. I would introduce all our participants to our very dear principal, ma'am. And ma'am, I would like to welcome you and invite you to say a few words and invite our guest speaker to initiate the international workshop today. Over to you, ma'am. Thank you.
Yes. Good afternoon, all. A very warm welcome to Anna, who has joined us from Saudi Arabia. I'm very thankful to you, ma'am, that you have joined us. And you are going to guide our students on a very important topic because I think what we understand is, I think this should be very clear to all that health is wealth. And you should begin very early. If you are, yes, this consciousness about health should become very early. And you see, it is what we do is we eat incorrect things. We have a sleep schedule that is very, very erratic and so on. And as a result, what happens is that we really harm our health. So all the diseases are in a way related to our lifestyle, and many things, even for that matter, I think Anna is going to guide us on this, that even these kind of incurable diseases, which so-called, can be mended or they can be stopped at least with a correct lifestyle. So it is important that we really adorn good lifestyle at a very, very early stage. For this, I think very simple thing is just don't have any tension. And what is important is that you lead a life, of course, seeing your goals, but don't take tension about it. Also, what is important is your diet, because without correct diet, I think we'll end up nowhere. And there are certain fruits and vegetables which really help you to maintain your diet, good diet. What we are, especially the youth is doing is that we are relying more on aerated drinks, and even to that matter, there are people who go into drug abuse and so on, and really they harm their lives. So your diet should be correct, taken at right time, and that gap should be very, very proper, and a kind of a balanced lifestyle should be there. And then of course you should avoid various things like drugs, I said, alcohol, and even for that matter there are some people who resort to smoking and so on. So that is wrong. Also important is that you have adequate vitamins and minerals. I think this is what sometimes we miss upon it. Maybe I think if we see, just to take an example, even I got my vitamin D tested a few days back, and it was not up to mark, and I had to take, and otherwise I go out in sunlight also, and it's a kind of a proper thing. So we never know. So this kind of routine kind of testing is also important, and these adequate vitamins and minerals are also important. See, the young people, they feel that they don't have these kind of problems, but they should also regularly maintain a regular lifestyle also with proper supplements. And I think Anna is going to tell us how this kind of what kind of a diet is going to help you, firstly, in a preventive manner, that the disease will not come. Secondly, if a person has kind of a disease, then how to, balance it and how to check it and so on. So these kind of things are very important. And this awareness about health is very important. And it should come early, because at your age, I think I'm telling the students, because at your age, we don't realize, that fitness is important, walking is important, or running is important. But later on, then, we don't have stamina also. And later on, we realize the importance of it. So go in for physical exercise, go in for physical fitness programs, and also avoid too much of sitting and so on. So these are very simple formula which will make you healthy. And I'm very happy that the IQAC and the sports board has really thought of this kind of program. And for that, Charanjit and Gursharan and all the sports board members, they have done a good job to train the students on very pertinent topic. So all the best. And once again, I thank our guest for today, the speaker for today, and also the sports board members and all the students who have joined. So thank you very much.
Yeah, ma'am. Thank you very much.
Now, Anna, over to you.
Okay, thank you so much. First of all, thank you so much, everyone, starting with Gushran, who challenged me on a social media post to join you and do this presentation. I'm going to try to speak slowly because, well, I'm Portuguese. We speak very fast and we speak a lot with the hands. So I'm going to try to speak slowly as much as I can. So let me do a small presentation of myself. My name is Ana Margarida. I'm a fitness sports coach, or whatever you want to name me. I did my sports degree certification, my sports degree in the University of Lisbon, and I always worked in the fitness industry, which was really, really nice because I really could understand how the normal people could face or understand fitness and physical activity. I'm also a breast cancer survivor. That's why this theme is so attached to me. And as the principal was saying just now, maybe some of you are 18 or 20, so you think someone with 38 is already very old. But when you reach 50, you realize, oh, 38, I'm not so old. I'm actually very, very young. So I was detected with breast cancer when I was 38, which is a very, very young age. There's no family history, but when I realized my type of cancer, I realized that I had 8 of 10 risk factors just because of my options in life. I decided not to get pregnant. I decided not to breastfeed. I had my first period very young. And although I had a huge amount of things I was doing well, like good nutrition, exercising all my life, and all those things, avoiding risk factors like drinking too much, smoking, etc., I realized suddenly life just is not, you are just one of the unlucky ones. And the fact that I didn't had kids, I didn't breastfeed, I had a very early period, starting of my period, put me in a risk population. And we don't even realize that this can be, this kind of things can be risk factors. Anyway, this was 14 years ago. I'm now 52. Considered cured for many years now, and we are here today to talk about physical activity and the role of physical activity and lifestyle in prevention and treatment and survival rates of breast cancer patients. One of the most important things is detection and early detection. Early detection is basically what saves people's life. And although we are in the 21st century, it's amazing how this is still a subject so hard to persuade women to do their self-check exams. Don't wait for the last minute. Consult a doctor, the minimum sign of alerts. And that's what happened to me. I realized something was, I had like a small lump. It was nothing for 5 years because it was just a normal thing. Women, we have boobs, we have breasts have tissues, and those tissues sometimes they change. And so I noticed, and for 5 years I supervised, literally I supervised every year with medical reports and every other week with my own self-exam. And out of the blue, suddenly my lump was different. And something that was good for 5 years became bad in less than 1 month. And then we took care of it. And it was a very, very early stage and everything went well. And 14 years later, I still have the same survival rate as any other woman on my age. So this is a little bit of my story. So, and this is like, and I think the most important part of my story is don't wait, go and check yourselves. Promotes you the check on your mothers, on your grandmothers, talk about this, because you can actually be very, very helpful to cut things in the beginning. And I have a very funny story in my family. My mom is a former nurse and she was super worried. I think she was the person more worried and more in panic in the family. And my brother is a kind of funny guy, also a sports science person, working with professional athletes. And when they said something very funny, if it has to be, let it be on the boobs, because it's highly treatable. Because it's true, we can detect them and treat us and treat our family and help our families with this. So no further ado, let's talk a little bit about this physical exercise and breast cancer. I'm trying to share. Okay, so the role of physical exercise, let me just take my video off, otherwise you see like a cartoon. The role of physical activity in breast cancer diagnosis and treatment. Okay, so the big thing nowadays is we know so much and we don't know so much more. Basically nowadays, what do we know? We know a lot. Science is incredible. Sports science has been one of the fields of science with more developed in the last 25 years, 30 years. But as more we know, more we also don't know. We still have more questions than answers, but the answers that we have are already so many and so good that we can actually help breast cancer patients and survivors to have a better quality of life and really big survival rates. The big answers that we don't have exactly, the big questions that we don't have exactly answers nowadays, we have lots of studies, and studies give us different answers, all good ones, but different ones are, what is the ideal exercise prescription to prevent, to treat, and to help in the survival rates? There's lots of information, but there is not one right answer. There's several right answers. The other thing is the underlying mechanisms that explain how physical activity has positive impact on breast cancer prevention and treatment are still very unknown. So we know a lot about regular health, but we don't know so much about specific breast cancer health improvement. But anyway, we know enough to take good decisions. So some of you are sports science students, and the question is always, what is physical activity, what is physical exercise. Most of you probably know that physical activity is any kind of movement that we do in a daily basis that require energy. So speaking is a physical activity, walking is a physical activity, walking the stairs, walking the dog, brush the hair, vacuum the living room. These are all physical activities, and they are very important as a part of accumulated activity that you can do for your body through the day. What is physical exercise? Okay, so basically it's movement that it's planned, is structured, is repetitive, and is intentional. And the goal is to promote physical fitness. For today's talk, we're going to just consider just physical activity as everything. As you can see in the picture, physical activity can be walking the dog, walking up the stairs, running, helping in some handwork at home, painting your room, vacuum the living room. Let's put all this as part of movement, and let's call it physical activity or movement. Okay, so what we know about physical activity and breast cancer. We know that physical activity decreases breast cancer risk from 25 to 30%. Some studies say reach the conclusion that it decreased the risk by 16, some by 32, but a normal number as accepted by scientific community is around 25 to 30%. Physical activity has a positive impact on the side effects of the disease and treatment, and we're going to talk about them slightly later. Physically active breast cancer survivors have 30 to 50% reduced risk of recurrence and mortality. Super important. Even if you never exercise in your life, it's never too late. It's never, no matter what age you are. If your grandmothers, your mothers, doesn't matter if they're 50, if they're 70, they never exercise, they have an episode of breast cancer, it's time to exercise, because an active lifestyle will increase their 50% rate of survival. And if you think about some of your grandmothers, for example, if they are 70, they have 10 more years of life expectancy. Why not give them to them? Give this to them instead of having 5 years. Now, we also know that higher levels of physical activity leads to better results, okay? So doing some exercise is good, doing more exercise is even better. That's what the studies tell us. The other thing is very important when we are living with breast cancer is patients, women who had breast cancer or who has breast cancer, even when they are physically active before the disease, they tend to become more sedentary. The reasons are several. Is like the psychological impact, is the treatments. Everything can influence this low adherence to the physical activity, even for women and some men, of course, even for women with active lifestyles. And again, there are still more questions than answers regarding the ideal type, intensity, frequency, duration of exercise protocols. However, there's enough information to prescribe efficient training protocols. Let's move forward and see some of the things. Okay, so what is important for breast cancer? What is probably two of the most important things? We know that some factors of physical activity in the human body. The most important two factors are how we regulate insulin and estrogen. These two hormones are the fuels of breast cancer cells growth. Okay, so insulin is an hormone. Regulates the metabolism of carbohydrates, fats, and proteins in the body. And estrogen is a sex hormone that regulates the female reproductive cycle. They are normal, they are good, but they can be the fuel that fire up the growth of breast cancer cells. So we need to be very, very careful. So we know that exercise consumes and controls blood sugar levels and limits blood levels of insulin. So you can see immediately the relationship between exercise and, of course, the control of this hormone. The food intake, our food habits have a really, really important role here, because we basically can't out-train a bad nutrition. So it doesn't matter how much exercise you do, if your nutrition is not healthy, is based on processed food, high caloric intake, it's going to be very, very hard for the exercise to compensate the bad nutrition habits. When you talk about estrogen, so estrogen is produced most of the time, well, till your menopausal age, through the ovarians. But after menopause, the production of estrogen happens on the fat cells. So we can see immediately the relation. Extra fat cells produce more estrogen. More estrogen produce more cancer cells in the breast. So here we go again. If we can control our body composition with low levels of body fat, we are probably saving ourselves to put in some risk. So you can see, like, a healthy lifestyle with good nutrition and regular exercise immediately can help to control these two factors, the insulin and the fat cells that produce the estrogen. We also know that physical activity has a good impact in the immune system. So our body is ready to fight any not so good cell who tries to basically disturb our well-being. And the other thing is the psychological and social aspects of physical activity are as important as the physical aspects. And this is basically the most important things about exercise and nutrition regarding the growth of cancer cells in the breast. When you think about the role of physical exercise in a breast cancer diagnostic and treatment, we have to think about basically three stages: the prevention, during the disease and treatment / therapy, and in survivors, after you are considered clinical cured. So let's see in the different three stages. Regarding prevention, we know that we know the studies show us that the physical activity reduced the risk of breast cancer in pre and post-menopausal women by 25 to 30%. The number may not look so very big, but it's absolutely important. We know that per year, around 150,000 women die. Well, more than 100, like 500,000 women die from breast cancer. From this 500,000, 1/3, around 150,000 die, and those deaths could be prevented by physical exercise, lower calorie intake, and avoiding overweight. These are the three big devils when we talk about prevention. What we know in prevention, any type of exercise at any age, it's good. Doesn't matter if it's swimming, weightlifting, running, walking your dog 2 times a day. Everything you can do is gonna help at any age. And nowadays, with what we know about metabolism, we know that the choices that we do with 20 years old are gonna dictate our health with 40 and 50 and 60. Some things you can't control, but the environment factors you can control. Most of you ladies are much more careful than me, for example, because when I was 20, I would burn on the beach under the sun. That I'm paying now because my skin looks old and burns. Luckily, I don't have the other things like skin cancer, but this kind of options, aside of the aesthetical part, have really, really good and very big impact in your health. So remember, whatever choice you do with your 20s is going to have impact in later in your life. Whatever happens with you with 40s, especially environment factors, they're going to be decided when you are 20 and 30. Your 20s is going to basically define your health on the 40s. Your 30s are going to define your health on the 50s. We also know that higher intensity exercise protocols produce more benefits. This is a very, very out of the box approach. I can tell you, like 10 years ago, you would never recommend to a breast cancer patient to do HIIT, high intensity interval training. No way. Or strength or weightlifting. No way. That was too extreme. It was considered too extreme. We know nowadays there's no problem with that. Like several studies actually show us that high intensity on the protocols actually produce more benefits. So for prevention, let's follow the general recommendations. And usually the American College of Sports Medicine, it's our reference institution. 115 minutes of moderate to intense aerobic activity, resistance training, weight training, 2 or more times a week, some flexibility training, also 2 to 3 times a week. General recommendations. We know if we can follow this, we're going to have probably better health indicators later in life. I was talking just before this talk with Bushran. We know it. We met each other 10 years ago, and still today, everyone is fighting. I don't have 30 minutes to exercise every day or 3 times a week. It's a question of priorities, and it's true. And we probably have time to go to Instagram. You probably have time to go 10 minutes to Facebook, or if you are all 20s, we are probably Instagram users, not Facebook users. If you are like me, you are both users. But we probably have time to go to Netflix. So we really need to find time to take care of ourselves, because later we're going to find time to go to the doctor. And this we all talk, we all know, but I know it's much harder to do than say. But again, this can define how your health is going to be in 10 years time, 30, 20 years time, 30 years time. So, and then if we are unlucky, we may have a disease. Some of us, we have it, and it's going to be much more common than we think. So, and when you are diagnosed, I have breast cancer. So now what? First of all, it's important to understand what type of cancer is diagnosed and in which stage. The other thing that I really think it's important, find support in your medical community and find information in the medical community, the people that actually is taking care of you, and in the support groups regarding the breast cancer foundations and all these kind of institutions that all countries have. Google can be very, very tricky, okay? And as we all know, you find everything on Google, but you also find lots of misleading information. So first thing, don't panic. Try to get informed. Don't panic. Get information from the proper institutions, from the proper people. So I have breast cancer. Now what? I used to say, everything changes and nothing's changed. Everything changes because you need to understand which type of cancer you have and what is the stage, because this is going to define a few things in your life in the next months or years. And nothing's changed because you can't just feel sorry for yourself and sit yourself in the couch. You have to keep living your life. You have to keep living your life. And sometimes it's literally you have to drag yourself out of home, out of the couch, and make the effort. Because this is one of the most important parts of the treatment. You have to drag yourself through your normal life. But anyway, some common questions regarding exercise, because there's all the psychological aspects of this. Can I exercise? When can I start to exercise if I had surgery? What kind of surgery I had and what can I do? What kind of exercises then can I do? And the right answer, it depends. It depends on your type of breast cancer. It depends on your stage, and it depends on the treatment that you are going to be submitted. It depends on your body. It depends on your exercise history, your lifestyle history, and it's also depends the approaches of the doctors. Although nowadays they all promote physical exercise, sometimes without knowing exactly what they are doing, but they say just exercise. Then I hope all the sports science students and future professionals should be there to actually prescribe the right exercise. So in this stage of treatments, disease treatment therapy, what we know, start the exercise as soon as a couple of days after the surgery, if you had surgery. And most of the breast cancer patients, they will have surgery. Different types of surgeries. Sometimes it's just remove a lump. Sometimes are mastectomies to remove one breast completely with lymphatic nodes. Sometimes it's two breasts. There's all kinds of, like a few kinds of surgeries, but depending on the surgery, first recommendation, start to exercise as soon as a couple of days after the surgery. And this is okay. If you have a surgery which just removes some breast tissue and the lumps. And start to exercise may mean brushing your hair, may mean brushing your teeth, may mean try to do your own bed, moving your chairs in your living room, making your arms work or your arm work. Usually is the arms the big worry of the women. All the households, house duties, carry lights, shopping bag. All these are exercises you can do. Some things are slightly more complicated. For example, in case of mastectomies, where women were removed one breast or eventually two breasts, then it's different. Probably have to wait a little bit longer, up to 8 weeks before they start to exercise, because there's drains and stitches and drains and incisions. They need to be off, and they need to be the tissues. They need to be healed before you start to exercise. But you start exactly the same way. Next. When you start to exercise after surgery, usually there are 3 phases. The first phase is 3 to 5 days after surgery. And basically we are going to be focused on shoulder and arm mobility. Again, brushing the teeth, brushing your hair, closing doors, carrying small shopping bags or light shopping bags are part of this treatment. Mobility for the shoulder and the arm. All exercises are important. Focus on the breath, especially using the thoracic area of your body to improve thoracic breathing. If some of you are familiar with Pilates, Pilates is a technique that promotes thoracic breath and the work of the diaphragm to improve breath capacity. So it's really important to promote. And body awareness. It's amazing how when you go to the work market, understand that people, they don't actually know when you talk about pelvis, what is the pelvis? Where is my pelvis? What are my ribs? shoulder blades, scapula. It's really, really important to develop this kind of awareness on the women, so you can actually help them in the exercise prescription. Then you go to a second phase of exercises, 2 to 4 weeks after surgery. So it's time to go for more deep stretching exercises and start to introduce resistance. When we say resistance, is weight training. Start to pick up a few dumbbells. You can start with small dumbbells, 1 kilogram, elastic bands, anything, something that adds loads. Make the muscles work, because those muscles, they need to get stronger again. Body alignment is important, because sometimes people just feel a little bit weird because part of the breast could be removed, like mine. It was not very significant, but yeah, I have one breast slightly smaller than the other. It wasn't a big issue for me because I'm from sports science, I know my body, but it can be a big issue for a normal person who doesn't lead so well with the body things and develop body awareness. Nothing happened in the sense you are not less woman than you were before, and you can still have a very normal life. Then on this exercise prescription, we have a third phase, and this third phase is the strength and increase in range of motion. This is the phase that women should exercise as any other person with the exercise prescription recommendations. On this phase, you should not have, you probably don't need to have extra care, except for some signs for swelling, if it happens, or some pain. But this third phase, it's already like 6 weeks, 8 weeks after surgery. So it's usually a phase that women can just start to exercise in a normal way, as we prescribe exercise with healthy women or healthy people. So no big issues on the exercise prescription. Some recommendations, especially on the phase first and second. Don't try to rush the person through the phases. Focus on the quality of movement. And if you are trying to improve the movement of the arm, don't rush that part to the second phase to get some resistance band while the mobility is not there. Focus on the quality. Make the women work in discomfort, not in pain, but we need to have some adaptation. So we need to go to a little bit of discomfort. It needs to be a little bit hard. Otherwise, the benefits are compromised. Avoid fatigue. Sometimes I'm super tired. Remember, some of them are going through chemotherapy, radiotherapy, hormone therapy, and this brings fatigue. When you are exercise, avoid, if you find some swollen, you have to stop. And remember that exercise is to prevent the swelling and to improve circulation. The feeling of burning, tingling, numbness, soreness are normal, and they are more intense in the beginning, and they decrease as you keep the exercise routine going. And make sure that if you are prescribing exercise, the women rest every time they need. Okay, but this is like a normal rule for everyone. Side effects of therapy. Whatever is the therapy, it can be chemo, radiation, or monotherapy. As a general rule, women, they lose muscle strength, they lose physical performance capacity. They probably used to climb 3 levels of steps, they probably only can climb 1. Body composition can also change, moods, and 2 very important ones, fatigue syndrome and respiratory capacity. So these are the really most important factors. Fatigue syndrome is something that 80% of the patients of breast cancer will feel during the therapy. they are always tired. And even after therapy, the women, 30% of the women are going to still feel this fatigue syndrome. This fatigue usually comes with pain, stress, anxiety, depression, sleep disorders. So it's like it's a vicious cycle. One thing is interfering with the other, and the fatigue leads to sleep dysfunction. The sleep deprivation leads to fatigue. So we need to try to stop this cycle. Exercise is absolutely amazing to help because it improves the sleeping cycles and improves the moods, help to manage anxiety and stress, especially in groups. So it's really, really good to control the fatigue symptoms. The respiratory capacity, also because of the treatments, we know nowadays that the respiratory capacity in patients is 30% lower than in sedentary women. Even if this patient was an active person before breast cancer, if they go through any kind of treatment, their VO2, their capacity to get the oxygen from the air, bring the oxygen to the tissues, do the gas changes, take the CO2 out, put the oxygen into the body, is decreased by 30%, even when compared with sedentary women. You know how important exercise can be to control this respiratory capacity. And these women are also more in risk to develop cardiovascular disease, because chemotherapy affects the function of the left ventricle and the heart, provokes arrhythmia, and can also lead to myocarditis, so inflammation of the pericardium and inflammation of the muscle of the heart. So exercise, especially cardio exercise, endurance exercise, can really be very helpful, leading with these two effects of treatments. Nowadays, what we know, there's lots of guidelines, but for breast cancer patients, in terms of strength training, the general guidelines are weight training, 1 of 3 sets for the major muscle groups in the body, 8 to 12 repetitions, 60 to 70% of the maximum loads of the person can hold for that muscle group. For cardio, 20 to 30 minutes, most days of the week, 5 days, it's recommended. 60 to 80% of intensity, of maximum intensity of the heart rate. It can be done in a continuous way or in interval ways. And we also know that, for example, nowadays, high intensity interval training programs produce even better results for cardio health. It's really a significant increase. The VO2 max can increase 64 to 90% in breast cancer patients using high intensity interval training protocols. For survivors after breast cancer, we know that they have, if they are active, they have a decreased risk of recurrence, that's getting sick again. And they have a much higher increase of survival rates. For survivors, there's recommendations from several institutions, from American College of Sports Medicine, from the American Cancer Society, for the World Cancer Research Fund. And the recommendations are pretty much as the general population: 115 minutes of moderate activity or 75 minutes of vigorous activity per week. More recent studies, and these recent studies are from like 2-3 years ago, actually tells us that we should go a little bit harder and make these women work a little bit with more intensity. Endurance training, 30 minutes, at least 3 times a week. Resistance training, 2 to 3 times a week. Introduce flexibility training. If you exercise more and with more intensity, you get better results. And the most updated recommendations go to 182 to 140 minutes of moderate activity per week, which is significantly higher than the general population. And to be honest, this is the point, if someone went through a breast cancer episode in their life, they have to find the time to do this because it's their life. It's their choice. It's not anymore about I want to lose 5 kilos. It's not anymore about I want to look better. It's not anymore I want to fit in my jeans. It's not anymore the pressure of society. Is I want to live 10 years or I want to live 15. So, and this is sometimes the moment that we need to tell those students or clients, say, it's up to you. And this is not anymore about statics. This is not anymore about social pressure. This is about seeing your children or your grandchildren growing for 5 or 10 years more than what is expected for you. So there's 3 things that we have to be careful, and these are basically the things that we have to take in account to stop exercise. If there is a low level of hemoglobin because the transport of oxygen is compromised, if there is a low level of platelets, which may be causing difficulties on blood coagulus, because basically those components of the blood stop bleeding, and if it's a metastatic breast cancer, if the cancer is spread through other parts of the body. Other than that, there is no reason for a woman to, after breast cancer or going through treatment, stop to exercise. As a two final notes, knowing all this, why adherence rates are so low? And because it's really true, adherence to exercise rates are low. They are low because most of the time women don't have the right information. They have misconceptions. And one of the biggest recommendations from all the hospitals and foundations who would deal with this kind of things are basically this. We need to train our medical staff. And the most important people to be trained regarding physical activity should be the nurses, because the nurses are perceived as the people breast cancer patients rely the more. Amazing, huh? It's not the surgeon, the nurses. The nurses are the most important medical staff. So the recommendations is educate the nurses, because they are actually the ones who are gonna make an impact to motivate women to exercise. They are the ones who spend more time with the patients. The doctors, they do the surgery, they go to the next. The nurses are the people who are really there. So this is really, really, really important. There's some hospitals in Germany, for example, developing exercise programs for nurses, so they actually feel on their own bodies all the benefits of exercise, so they can promote it through the patients. So as a general conclusion, what we know: move, exercise, call it activity, movement, or exercise, just make your body move. We also know that supervised programs, people work in groups and with coaches, they have better results. All the psychosociological factors help to maintain the adherence. And the support of a coach makes the difference in motivation, and the support of the other people who exercise also make us different with the motivation. We also know that the people or the women who are going to get more benefits are the ones who need it more, and usually are the ones who never exercise. It's almost like a weight loss program. If you are very, very fat, when you start a weight loss program, you lose much more weight if you are just overweight. So it's the same. If you need the exercise, the more you're going to get absolutely more benefits from the exercise. To finalize this, I would like to share with you a 3-minute video. It's from Singapore, a group of people with who I exercised. The people that you're going to see in the video they are going through chemo, they are going through radiation. Some of them had single mastectomies, some of them had double mastectomies. Some of them had cancer 14 years ago, like me, and so are perfectly healthy nowadays. Some of them are going through chemotherapy on the week they were filmed or photographed. And you're going to see the video, and I think it's very, very clear about breast cancer should not be a factor for you to stop to do anything exercise related. And I'm back on screen. Okay, ladies and gentlemen. Oops. Sorry. All right. Technical glitches. Okay. Ladies and gentlemen. My presentation is done. So if you have any questions, we have.
Okay, so thank you for the wonderful workshop session, Anna. We are glad we are joining session with you. You covered all the basic details which we never knew. Really so informative, like you told about your life experience, physical exercise, physical activities, and like goals of physical fitness, age no matter, whenever you start ages. So a human body, gross of cell increased, lumps and etc. So now it's time to question and answer round. We have some question by the participants. So I ask you one by one and you answer all one by one. So the first question is by Anshu. What type of doctor should I see if I think I have a breast cancer?
First, you have to go to your general practitioner, doctor, and he will basically refer you. Usually what the doctors do is if there is any suspicious lump or anything, they will request some diagnostic exams, and then which is usually a mammogram and the ultrasound. And from there, whatever is the result of those exams, they will refer you to a breast cancer surgeon, usually.
Okay, so the next question is from Asreen Kaur. I have read a little about the BRCA gene mutation. Can you elaborate on that too?
Well, that question is very specific, very medical specific, and that question I would not like to say anything because this is very medical driven, and I can say a few things, but I could be misleading people. So I think that is something that the doctor should answer, because it's the BCA, the mutations, and even in the medical community, there is lots of discussion about this. There are people who just do mastectomies even before breast cancer because they don't want to have the risk because they have the gene. So this is a very sensitive question. I think it should be done to the doctor. I'm so sorry.
It's okay. So now the next question is from Priyanka Yadav. How do I know whether I am at the risk from breast cancer?
Sorry again.
So the next question is from Priyanka Yadav. How do I know whether I am at risk for breast cancer?
I don't know. I actually don't understand very well. Can I see the question on the? Oh wait. Okay. I don't know. Okay, I got it. Well, if you have breast cancer in your family, you know that you should be more careful. If you don't overthinking. Don't panic. Don't overthinking. You know, those things is. I had a few risk factors because I never got pregnant with that. I just can't overthinking and be worried about that. Most important, check yourself. After 35, check yourself. After 40, do your annual exams. This is the most important thing.
So next question is from Anushka Gupta. Does breast cancer affect breastfeeding, or there is some connection in between them?
Depends on the stage. After you are considered treated, usually everything is normal. The moment the woman gets pregnant again, she had a breast cancer, she had a breast cancer event. The moment she gets pregnant, the body heals, she's ready to breastfeed. Usually there's no problem.
Okay, so the next question is from Nikita Agarwal. What are the symptoms of breast cancer?
You don't have. That's the problem with cancer. You don't have symptoms. Eventually, rarely you have like a nipple drip, or you don't have mine. You don't. That's the problem with cancers. You don't realize that you have them. So that's why self-examination is so important. Touching your breasts, learn how to do the circle movements, do the normal checkups per year when you after 40, 45, follow the recommendations from the international community, medical community, because you don't know. That's the thing, you never know. And most of the problems with women is when you find, it's too late.
Okay, so the next question is, it is normal swelling in breast sometimes just after or before periods?
It can be.
Okay.
It can be.
So the next question is from Anjali. Ma'am, what kind of exercise should we do to prevent breast cancer?
Anything, just move.
Okay.
Anything, move, whatever you like. You don't like to run, dance. You don't like to dance, walk. Find the exercise that actually makes yourself motivated to exercise and move. Doesn't matter what, as long as you are moving.
Okay, so the next question is, why do they cut off breast if you have breast cancer?
It depends on the stage. Sometimes the breast cancer is so advanced that they have to remove all the tissues around. For example, on my case, they removed the lump, and then they removed the tissues where the lump was in contact. And then the tissues go to analysis. And if the tissues are clean, you are okay. If they're not, they have to clean more. So basically, the breast tissue is removed to make sure that what stays, it's clean, doesn't have any cancer cells.
Okay, so the next question is, ma'am, do diabetic patients has more risk of breast cancer or not?
Can you repeat?
Do diabetic patient has more risk of breast cancer?
Not that I know of. Although they have an issue with insulin, but as long as they are controlled, I never found anything with a direct relation between diabetes and breast cancer.
Okay, so the next question is, does the breast cancer to reach other part of the body?
Just make sure that you cut your breast cancer early enough.
Okay. So the next is, do we need to avoid anything we are suffering from breast cancer?
Alcohol, smoking, processed food, the same thing as you are a healthy person, but be more careful now.
Okay, so the last one is after the.
Let's take the last question now. Yeah.
Okay, after the cancer has been cured, what are the things that can help me for the sooner recovery?
Healthy eating, exercise, and find the social network of people who live the same, with who you can share things that no one else is going to understand. Find your group of breast cancer foundation activities, find your support group, because you can't talk about your feelings after chemotherapy with someone who never had chemotherapy treatment.
Okay, so thanks for the answer. I hope everyone's queries are clear now. Now I would like to invite Chiranjeet ma'am, Head of Department Physical Education, Mata Sundari. She is volleyball player, international volleyball player, recently represent India at the World Match or our HOD to conclude the session and purpose vote of thanks.
Thank you very much, Sakshi. proposing the vote of thanks, I just want to share some of my experiences. Like one of my friend, she is also suffering with the breast cancer only. And the moment she got to know, it was too late. As you say, Anna, there is no, there is no symptoms of, like people have breast cancer or it started or not. So just gradually in the period of 6 months, because she lost her husband, and because of that she was much occupied with some like housework, family settings, upbringing the kids, her family. So she was avoiding and she was not taking care of herself, and she lost her life in the month of October only. So I remembering her today only. And thank you, Anna. Thank you very much for sharing your experiences. And
Most welcome. It was my pleasure.
so formally, I just want to propose vote of thanks to each one of you. It gave me immense pleasure, and I'm feeling honored to propose the vote of thanks for the 2 days event to all the participants. First of all, I would like to thank dear Anna Margita, our eminent speaker of the today's workshop, and sharing her experiences on the topic role of regular physical activity, breast cancer, diagnosis and treatment. Thank you, dear Anna, for enlightening us with your knowledge and making this workshop meaningful and interesting. Thank you, dear.
Most welcome. I hope you will enjoy it and
definitely.
And get like important insights.
Okay, so
I'm thankful to
all.
our beloved principal, Sakshi, wait. I'm thankful to our beloved principal, ma'am, Professor Harpreet Kaur, for always being supportive and encouraging to organizing such events. I would like to extend my sincere thanks to Dr. Lokesh Kumar Gupta, the IQAC director, for providing his unconditional support. I'm also grateful to all my sports board members for always showing their interest and motivating us in the department activities. Organizing such kind of department activities, I'm grateful to the beautiful program coordinator and my dear colleague, Dr. Gursharan Kaur, for her devotion and enthusiasm to organize this program. A big thank you to Ms. Sakshi Singh and Ms. Guneet Kaur, our host for the today's event. I'm also thankful to Dr. Sangeeta Pathak for all the technical assistance to run this program smoothly. I would like to thank my dear colleagues, students, and all the non-teaching staff members for their presence. Last but not the least, I thank all the participants for their presence and making this event a great success. Thank you, everyone. Thank you very much for joining us. And I wish you a very healthy and successful life. Thank you, everyone. Thank you very much.
Thank you, ma'am.
Thank you so much.
Ma'am. Now I would like to request you all, please on your camera, so I take photograph. Please, all of you, on your camera.
Make it in a tile shape, now then everybody will be covered. The view.
Yes, ma'am.
Is
Please,
it
everyone
changed
on
now?
your cameras.
Yeah. Sakshi, you'll be
It will
able
be
to take
wonderful
the
if you
screenshot?
visit India and
Just
come
a
to
second,
us.
ma'am.
We
Yeah.
definitely want to meet you and listen to you more.
So as the COVID restrictions will be levied off, ma'am, so the next workshop with Anna we'll have in India.
It should not be virtual, it should be live.
Thank you so much.
Thank you. Thank you very much. Yeah.
Sakshi, taken?
Yes, ma'am.
More Sakshi.
Yes, ma'am. Second. Done.
Done. Thank you, everyone. Sakshi, please share the attendance come feedback form in the
Yes,
chat
ma'am.
box. Whosoever will fill the attendance come feedback form, only those participants will be will get awarded with the certificate. So please treat it as important. The link has been shared. And once again, I thank you all for participating in such a huge number. It was overwhelming. And thank you, Charanjit ma'am, for so nice words. And like one thank you is not enough to Anna. Like I have just gone back 10 years ago. Like I'm in the student mode again. I'm just remembering the time you were my ma'am. I was like she knows me. I was a silent one, the silent student in the corner, and now I am this because of her.
Oh,
All the
no, because
confidence
of
have been pumped
you.
into me by her during my Viva Fit training. I seriously cannot thank enough.
Thank
So-
you for having me. It was my pleasure. It was my pleasure.
Yeah. And I
See
hope
you
it continues.
Yes, we talk. See you soon, everyone.
Yeah. Thank you.
Bye, Anna.
Bye-bye.
Bye. If you have any problem, please drop your queries in chat box. We
Can
are
I
waiting
leave,
for
Kurshan?
5 minutes.
Hanji, ma'am. Thank you so much, ma'am.
Thank you, Sakshi. Thank you, Guneet. It was very nice. And keep it up.
Thank you.
साक्षी तेरा टैडी इधर उधर क्यों जा रहा है उसको साथ लेके बैठती हाँ वो भी सुनता है पूरी
मेरा।
वर्कशॉप हाँ चलो थैंक यू एवरीवन
Extra
Thank you,
participant.
Thank you so
Fill the
much,
form.
Charanjit ma'am, Gursharan ma'am, for giving us this opportunity to be the host to this event, because it really during these while I was preparing for this, I learned really a lot, and it really means to me that you chose me for being the host of this event. Thank you so much. ma'am.
credit goes to Gursharan ma'am. She has a faith in you and she was very much sure that you will do it. And it was very
Thanks, ma'am, for believing on us. We are
Thank you.
waiting
Shall I
for
leave
so much
Gursharan now?
time.
Hanji, ma'am. Ma'am is always generous with the compliments. This is giving the responsibility to the younger ones. I have learned from ma'am, and that too with confidence. Ki acha kuch gadbad hoegi, so I know ma'am is standing at the back. So I have learned this quality from ma'am only.
मैम आप लोग से हम लोग को लर्न करने मिलता है लाइक कैसे
Yes.
मतलब कर सकते हैं
I guess तुम लोगों के साथ we all are very lucky that we are in this department. And अगर इसके बाद भी अगर कोई सीख नहीं पाते तो that is the fault of the person only.
Yes, Shivani Verma, why are you raising hand? Any problem?
Thank you, ma'am. I guess
Thank you.
after 5 minutes, then I'll just end the meeting.
Shall I leave?
Hanji, ma'am. Thank you. ma'am.
Okay, beta. Bye.
Bye, ma'am. Everyone, please fill the form.
Anshu is there. Thank you, Anshu, for your compliment. Sakshi, just let me know when to end the meeting, है ना?
Ma'am, Anjali is saying the form is saying we need to sign in to fill the form.
Sign in.
Yes, ma'am. Is everyone Done.
We'll change the settings. Just try again.
Anjali, please try again. Ma'am, should we end meeting now or not?
Yeah, we can. Baki, there is no such restriction in the form. अगर फिर भी कुछ आता है तो connect us on WhatsApp.
Okay, ma'am.
Right? ठीक है, we can end the meeting.
Okay, ma'am.
Thank you, ma'am.
Thank you,
Thank you,
Guneet.
ma'am.
Thank you, Sakshi. Well done. Proud of you.
Thank you,
so much.
ma'am. It was because of your guidance that we did.
Yes, ma'am.
Not at all. You did because you could. ठीक. Okay, bachas. Bye. And thank
Bye,
you,
ma'am.
all the participants, once again.
Thank you for joining, guys.